Welcome to aminacademy.com in abnormal psychology regarding major depressive disorder. Some case studies. Depression is a mood disorder that causes a persistent feeling of sadness and loss of interest, also called major depressive disorder or clinical depressions. It affects how you feel, think, and behave and can lead to a variety of emotional and physical problems. You may have trouble doing normal day to day activities, and sometimes you may feel as if life is not worth living. More than just about of the blues, depression is not weakness and you can't simply snap out of it. Depression may require long term treatment, but don't get discouraged. What are the symptoms of depression? Although depression may occur only once during your life, people typically have multiple episodes. During these episodes, symptoms occur most of the day, nearly every day, and may include feelings of sadness, tearfulness, emptiness, or hopelessness, angry outbursts, irritability, or frustration, even over small matters, loss of interest or pleasure in most or all normal activities such as sex, hobbies, or sports. Sleep disturbance include insomnia or sleeping too much, tiredness and lack of energy. So, ever small tasks take extra efforts. Reduced appetite and weight loss or increased craving for food and weight gain. Anxiety, agitation or restlessness, slowed thinking, speaking or body movements, feeling of worthlessness or guilt, fixating on past failure or self blame, trouble thinking, concentrating, making decisions, and remembering things, frequent or recurrent thoughts of death, suicidal thoughts, suicide attempts, or suicide, unexplained physical problems such as back pain or headaches. For many people with depressions, symptoms usually are severe enough to cause noticeable problems in day to day activities such as work, school, social activities, or relationships with others. Some people may feel generally miserable or unhappy without really knowing why. A sad or dysphoric mood is obviously the most prominent feature of clinical depression. Depressed patients describe themselves as feeling discouraged, hopeless, and apathetic. Now we'll discuss further detail about depressive disorder, some case studies. Case studies on major depressive disorder (MDD) is abnormal psychology illustrates how environmental factors like family conflict, stress, or relationship issues, genetic predispositions, and cognitive factors such as negative thoughts pattern can trigger and maintain depressive symptoms like a low mood, anhedonia, and low energy. For example, the cases of Sam highlights the effectiveness of interpersonal psychotherapy for adolescents. Now, factors influencing MDD. Psychosocial factors, stressful life events. Stressful events such as breakup, loss of parents, or family conflict can act as triggers for MDD. Major depressive disorder (MDD) or clinical depression is a mental health conditions in abnormal psychology characterized by persistent sadness, loss of interest, and other symptoms like changes in sleep and appetite, fatigue, feelings of worthlessness, difficulty concentrating, and suicidal thoughts, which significantly impair daily functioning. A diagnosis requires experiencing a cluster of these symptoms for at least 2 weeks, including either a depressed mood or loss of interest, pleasure. Interpersonal difficulties, strained relationships, lack of social support, and difficulties in communications can contribute to and maintain depressive episodes. Interpersonal difficulties are challenges in forming and maintaining relationships characterized by issues like poor communication, recurring conflict, difficulty understanding others, and a tendency for isolations or emotional outbursts. These struggles can be caused by factors such as differing communication styles, unmet expectations, lack of emotional regulations, or underlying mental health conditions. They affect a various relationships, including family, romantic, and professional connections, and can lead to loneliness, stress, and a reduced quality of life. Early life experiences, adverse childhood experiences, including separation from parents, can lead to negative schemas that are reactivated during successful, stressful situations in later life. Genetic factors, family, twin, or adoption studies indicate a genetic component to depression susceptibility with high concordance rates in monozygotic identical twins. Cognitive factors, distortions, negative thoughts patterns, and cognitive distortions play a significant role in the development and maintenance of depression in susceptible individuals. Learned helplessness. The experience of uncontrollable events can also be linked to the occurrence of depression. Example of some case studies: Sam, a soccer team captain, diagnosed with MDD after a fight with a teammate, showing an increase in symptoms over 3 months. Interpersonal psychotherapy for adolescents was recommended due to his challenges in family and romantic life. Next example is AJ. After a breakup, AJ displayed symptoms of depression, including hypersomnia, decreased appetite, and anhedonia, escalating to a suicidal attempt. Next case is Mr. X. This case highlights how negative childhood experiences such as abuse and neglect from a stepmother can contribute to psychological dilemmas and depression in adulthood. Treatment and approaches. Interpersonal psychotherapy, IPT, a type of therapy recommended for adolescents to address depression stemming from relationship difficulties. Cognitive restructuring, the process of identifying and challenging negative thoughts patterns and replacing them with more adaptive thoughts, as shown by patients' progress after therapy. Pharma- Pharmacotherapy, the use of medications to alleviate symptoms, though sometimes it may not significantly improve conditions functioning and on its own. So far, we discussed about abnormal psychology, in that major depressive disorder. If you have done, please subscribe our YouTube channel.